It's funny how kids who play in the dirt end up healthier than the ones who don't. Something about developing immunity, would that be? So when you close the schools during a pandemic and send home the kids, don't be surprised if with no chance to develop immunities, when they do come back to school, they get everything that's going around and they bring it home to you. The difference is, if we're talking about COVID-19, the kids are low risk for COVID, but moms and dads can end up feeling like they've been hit by a truck. People tell me it's like a once-in-a-decade dose of the flu. Unsurprisingly, then, the hospital waiting rooms fill up, and right on cue with the arrival of the fall flu season come the impassioned pleas for a return to universal, point of a gun, full weight of the law, mandatory masking. And if you don't, you're a sociopath. Seriously, if you don't care to cover your face, you're a sociopath. That's what they think at the Globe and Mail anyway, where columnist Marsha Lederman was emoting this week. She wrote, "Waits at emergency rooms, especially at children's hospitals, not just in Ontario, are unsustainably lengthy, at times forcing people to wait in the parking lot." Hearing those on the front lines, healthcare workers, parents tell it, the system feels like it is teetering close to collapse. It's terrifying. Well, first things first, Ms. Lederman also complains that anti-maskers can be belligerent. If they are, they need to lighten up. It's a free world. If somebody wants to mask up, let them, and then leave them alone. However, as far as all the emotional God help us stuff goes, Health Canada just doesn't agree with her. According to the Public Health Agency of Canada, who are the number keepers for all things COVID in Canada, hospital bed use by COVID-19 patients was actually down the week Lederman wrote her pearl clutcher. Take a look. Between November the 9th, 2022 and November the 16th, 2022, the total number of hospital beds occupied by COVID-19 patients decreased from 6,100 to 5,700. The number of non-ICU beds occupied by COVID-19 patients decreased from 5,800 to 5,400. The number of ICU beds occupied by COVID-19 patients decreased from 268 to 252. The number of COVID-19 patients who were mechanically vented decreased from 116 to 105. It's actually been dropping off since the middle of October. That's one thing. Now, here's one more thing. From the very same Public Health Agency of Canada's site, more Canadians have died from COVID this year than either 2020 or 2021. Truly. Let me show you. See these slides. At the end of both 2020 and 2021, Canada's Chief Medical Officer, Dr. Theresa Tam, issued statements on how COVID had gone that year. In round numbers, she said 15,500 people died of COVID in 2020, and at the end of 2021, nearly 15,000 more. This year, so far, nearly 17,000. Sure, the larger part was at the turn of the year, to be sure. But if you're under 70, let me just give you some reassurance. 82% of the 47,000 Canadians who have died since March 2020 were people over 70. Poor old sods like me then, but unlike me, having something else wrong with them. Bottom line, for all the masks and the vaccines, the social distancing, the lockdowns, and in Quebec, months of overnight curfews, none of it seems to have made much difference. This damn COVID virus seems to do what it wants, which, by the way, is also pretty much the way influenza virus consistently operates. By the way, in 2018, flu did to the hospital system what Marsha Lederman says COVID is doing to it now. Here's how Time magazine reported it then. It said the 2017-18 influenza epidemic is sending people to hospitals and urgent care centers in every state, and medical centers are responding with extraordinary measures, asking staff to work overtime, setting up triage tents, restricting friends and family visits, and canceling elective surgeries. A big deal then. And it was the same here. Ask anybody who you know who works in a hospital, they'll tell you. But masking, you'll notice, was not among the extraordinary measures recommended to deal with the flu 5 years ago, nor was sending children home from schools. Funny they didn't think of that 5 years ago. So why is it that the first thing that the Globe and Mail thinks of now, the Globe and Mail, and frankly, so many other people who are joining the mask up bandwagon, probably because it's an easy thing to say. It sounds community-minded, and calling people you actually look down on a little sociopaths makes you feel so righteous. Well, fire away, Globesters. Now you're getting paid by the government. We wouldn't expect you to say anything different. As for us, we'll go with Health Canada's numbers, and they don't say what you're saying. For the Western Standard, I'm Nigel Hannaford.
Canadian Shooting Sports Association. Without the CSSA, our gun rights would have been taken long ago. These guys are on the front lines helping to draft smart and intelligent firearms regulations and legislation in Canada, and more importantly, educating the public about how we keep guns out of the hands of the wrong people. You become a member, it's absolutely worth every penny. You can become a Western Standard member for just $10 a month or $99 a year for unlimited access.